Hi everyone. It's so great to see everybody. I wish we could actually see each other in person, but I know, COVID is still out there. A lot of people are still worried about being exposed to big crowds. So I do appreciate for everybody to come join us, Marcia, Dr. McGuire, and myself for today's lecture. I'm gonna try to keep things very simple. I don't have to introduce myself. Marcia already have done it, so let's get started. So I have no conflicts with this presentation. I put a couple of pictures of things, how they used to be. This is one of my colleagues who was intensivist during the COVID times. I just wanted to show you the picture of the old hallways when we had only COVID patients admitted to the hospital. It was empty. There were poles outside, ventilator screens were outside. Patients were in the rooms alone, no family members visiting, us and nurses seeing patients definitely once a day, twice a day if things were happening, feeding and other stuff. But it was a lack of what we have normally, the touch, the conversation, the interaction with each other that was lacking because of how little we knew about COVID and how severe it was and how many lives it took from us, our friends, our family members, and there were the lucky ones, people who got COVID who were not affected by it. So, as you know, COVID-19 is a disease caused by coronavirus. That initially has been diagnosed in December of 2019. That's when the first time we started seeing cases, people getting very, very sick, getting admitted to the hospital, and the whole world got affected. So millions of people have died around the world because of the COVID-19 infection. And we know by now that it is spread from person to person and is spread through droplets. So just to kind of a fun fact, do you guys know by any chance how fast the droplets travel when you sneeze or cough? Anybody? Just pick a number, at least one person. 1, 2, 3. Okay. Well, right. Let me just. Hold on, wait. Now I messed it up.
Go fast.
Okay. Oh. It's not working. Okay, here we go. So the sneeze definitely does win the race. And just to give you a perspective, when you cough, you cough up particles out of your lungs, right? The droplets. So with the cough, the droplets travel as fast as 50 miles per hour, and you can expel about 3,000 droplets in a one cough. That's a lot. When you sneeze, obviously the sneeze is much, much harder and stronger. So that can travel up to 100 miles an hour. So, and it can expel almost 100,000 droplets, which is huge. So imagine if you're sitting in a closed airplane, if somebody's at the end of the airplane, you are definitely getting those droplets at the very front of the airplane. So that's why all the restrictions were given at the very beginning of the COVID and through the pandemic, because how fast the droplets have been traveling, and people who have been in the area of you more, less than 6 feet or even more than 6 feet in the closed areas could get affected with COVID-19 virus. So we're getting into the post-COVID conditions. So this is a term that has been recently used for a wide range of physical and mental health consequences of COVID-19. These symptoms are usually experienced about 4 or more weeks after the COVID-19 infection. And patients who had no symptoms or had a very mild symptoms are very predisposed to having those complications. So because you had COVID and you just got diagnosed with a swab because you were traveling and you had absolutely no symptoms, it does not mean that you're not going to be affected by it in a couple of weeks. So just something to keep in mind. We have a couple of patterns of presentation. So obviously we have the acute COVID. So patients present with symptoms that last up to 4 weeks after acute illness presents. Then we have patients who have ongoing symptoms from COVID-19, and these symptoms range from anywhere from 4 to 12 weeks after you first get diagnosed. And then you have post-COVID-19 symptoms, which is the long hours. So those symptoms can range for weeks and weeks after you initially present with COVID. And patients present with very bizarre symptoms at times, which by regular diagnoses of autoimmune disorders, neurological disorders, respiratory disorders cannot be always supported. So this is something to keep in mind. So as I mentioned, COVID affects multitude of the symptoms. It can affect your skin, it can affect your joints, it can affect the way you feel psychologically, it can affect your diabetes, it can affect your heart. But in this presentation today, we're going to concentrate on the pulmonary complications, which are the most common after patients have been diagnosed with COVID-19 and if they're symptomatic. So just to take you back to physiology of COVID-19 in simple terms, when you get infected with the virus, you inhale the virus, you touch something, it's on your hands, you touch your face, you inhale stuff, it goes into your lungs. Once the virus enters, you have this, your body recognizes that this is something that should not be in your body, and you start developing antibodies. You start developing an immune system that fights that enemy that enter your body. So this is the macrophage activation. Subsequently, your body starts producing more pro-inflammatory cells, and those cells start fighting the infection, but also they cause a lot of inflammatory changes that can link to airway swelling, fluid accumulation, and many other issues, development of small little clots, and all of this is the cascade that your body is producing that subsequently leads to lung injury and multi-organ failure. So that's why patients, when first the COVID came in, people were getting very, very sick because how quickly the virus was working and also how our immune system has been responding to it. So the most common pulmonary manifestation we are seeing now in outpatient world are patients who did develop COVID pneumonia. Some people who have developed acute respiratory failure. So those are the patients who ended up being on a ventilator. So it means machine had to be breathing for them because they had no lungs. They could not get oxygen into your body. And then they develop interstitial lung disease, which is scarring in their lungs. Then we have patients who, because they've been intubated, meaning they've been on the ventilator, they had a tube going into their lungs for prolonged time that develop a narrowing in their airways, and that can cause a lot of symptoms. Then we have patients who have developed pulmonary embolism, pulmonary hypertension, reactive airway disease, bronchitis, and superinfections. So we're going to cover all of these today. So this is just a little table of symptomology, radiology, and physiology. So as I mentioned, COVID have affected multiple organs and how we feel. So you can have very vague symptoms or very specific symptoms: fatigue, dyspnea, shortness of breath, cough, depression, sleep disturbances. And that can go along with actually findings on your chest x-ray or a CAT scan. The most common findings that we see is inflammatory changes, which are those granulous opacities. Some people still have this consolidation, which is kind of this whiteout of part of your lung, and there's a lot of just mucus and inflammation in one area that can cause your symptomology. Some patients have a lot of scarring. Some people have a lot of air trapping, those non-specific small little inflammatory changes in their air sacs. And then lung collapses can happen because your lung tissue is so weak that your lung can collapse and because of the little hole that can pop open because your lung is so friable from the COVID. And then other complications after pneumonias, cavitations, lymph node enlargement, and fluid that can accumulate around your lung. All of these go along with decreased exercise tolerance. It goes along with abnormal lung function test. And this is what we usually ask pulmonologists do for patients when we test you to see exactly what's going on in your lungs. So once again, these are a lot of symptoms that go along with after COVID complications, but I'm gonna concentrate only on the pulmonary stuff because I'm the pulmonologist. I don't know much different. So there are people at risk. The people who have higher risk of complications are people who do have a chronic obstructive lung disease, They do have chronic lung diseases like already pulmonary fibrosis, interstitial lung disease. Patients who are active smokers. I'm sure all of you guys know smoking is not good for you. So if you're smoking already damaging your lungs, having a very bad viral infection in your lungs is not helping with anything and is going to only make things worse. Obesity also is associated with increased risk of complications after COVID, diabetes, hypertension, heart disease, being immunocompromised, HIV patients, cancer patients, and anybody who is over 65 years of age, which I think it's a new 45. So we do have a pretty significant disease spectrum looking at the data that has been collecting over the last 2 years. So 80% of infections right now are not very severe, which is good. We don't want to see patients who are hospitalized. And I'm sure if you talk to your colleagues, your friends, less and less people are getting admitted for COVID. And we are seeing a little bit of rise of the numbers right now, but it's not as severe as it used to be, okay? 20% of the patients will develop significant infection. These are usually patients who are a little bit older and patients who have significant comorbidities. A lot of those patients, and 50% of those patients, will develop hypoxemia, which is an ability to get oxygen in and preserve oxygenation at a certain level that's going to be good for your brain or your other organs. And what's important to mention is that people who have been non-vaccinated have much worse outcomes compared to patients who have been immunized. So definitely the vaccination are helping for patients to get through infection instead of going to significant multi-organ failure, and that can lead to death, potential death. So pneumonia and acute respiratory distress symptoms are the worst of the worst. So these are the patients who initially present with significant respiratory issues, very low oxygen, inability to breathe. And these patients have lungs that are filled with fluid. All the tissue in the lung is inflamed. There's fluid everywhere. And when this patient inhaled oxygen into the lungs, the oxygen does not go through to get to the vessels so you can distribute oxygen to the rest of your body, to your brain, to your heart, to your muscles, to your liver. So that's how we get to respiratory failure and then multi-organ failure, because the oxygen is not going through. So those patients either end up on a high flow oxygen, or we actually put them on a mask, on a BiPAP mask to get extra positive pressure to push the oxygen through all that swelling, or we have some of those patients get on a ventilator, they get intubated, meaning we put them to sleep, we put a breathing tube into your lungs so we can get the oxygen and we can give the patient a little bit of a break so we can work for them and try to fight the infection and have some meaningful recovery for the future. Some patients are very lucky and they recover without any lasting lung damage. And some patients do have significant lung injury, like scarring, breathing difficulties. However, some may improve. It doesn't mean that you're gonna get back to your baseline. Some people continue to get worse, and depending on your age, you might eventually end up being on a lung transplant list. So a couple of different pictures I wanted to show you. So all of these 8 pictures that you're seeing, both lungs supposed to be black. Who sees me in a clinic, I usually try to go over the images so you guys know. Lungs are filled with air, everything that's black, that's air. In the middle, the white part, that's going to be your heart. When you have the little split, these are your airways splitting. So everything around it, these are your lungs. So you can see fluffiness, some scarring, white stuff, holes in the lungs. So this is something that you don't want to have in lungs. This is the damage to your lungs that will continue to affect your well-being and what you do throughout the day and how you feel. So here are the perfect examples. The C and F, you can see there is definitely some scarring, fibrotic tissue, pneumonia-like picture. E has more of this kind of air trapping, but also significant bronchiectatic changes. So you have a variety of changes in your lungs that can be either significant, like pictures C, F, B, and E, and then less less significant, like picture A and D. So these are the patients. Picture NAD patients are patients who are gonna probably do relatively good and hopefully go back to your baseline. Everybody else is gonna be probably have some chronic complications that will definitely affect their day-to-day living and activities. So that brings me to tracheal stenosis. Tracheal stenosis is a narrowing in your windpipe. So when you go to sleep, when the anesthesiologist puts the tube for breathing into your lungs, there is a little cuff that goes around the tube that stays right kind of underneath your vocal cords. So that cuff helps prevents from the tube to moving out when the patient coughs, when the nurses move the patient to clean them, to give them medications, whatever it is. So what happens is, especially in our pandemic, unfortunately, because how little we knew about the virus and how contagious it was, those tubes have patients, it was very difficult to extubate patients for a very, very long time. So because of those cuffs sitting in a trachea, putting pressure on a tissue, it causes a lot of inflammatory changes, and this area eventually can start scarring over. So some patients started developing narrowing of the upper part of the trachea, leading to a variety of symptoms: wheezing, stridor, coughing, or respiratory distress. So it's fixable. Some people are very lucky, dilatation or stent placement or can be very helpful. Some people do have to get tracheostomy if the patient does not do well with just a non-invasive dilatation. Obviously, they might have to get tracheostomy, so it's a tube that goes into your lungs and bypasses the tracheal stenosis. Or some people are candidates of actually resecting that little area by a surgeon and putting your trachea, your windpipe together and resecting that area of narrowing. But everything goes along, what you qualify for and what are your symptoms. So pulmonary embolism, that has been relatively significant during COVID infection. Patients have been developing a lot of small clots that could affect their lungs, affect their extremities, affect their brain also. A lot of people had micro strokes, but we also have seen that patients have been developing clots several weeks or months after COVID infection. So that has to do with something called virtuous triad. So it's a three components of endothelial injury, which is injury of your blood vessels, then producing of the inflammatory cells, which makes you hypercoagulable, and then because you're sick, your blood is not moving through very well. You can be hypotensive, meaning your blood pressure is low, your heart is not pumping well, you have the sepsis-like picture, so your blood is not moving through your body very well. So all of these cause a blood clot to develop. Now we have noticed that post-infection, post-COVID, this pro-inflammatory state and thromboinflammatory state continues. Some people recover very quickly, some people continue to have inflammatory cells and hypercoagulable state for quite some time. And if you're not mobile, if you have a little bit extra weight on you, you're not very active, you have other significant medical condition, you are at risk of developing clots in your lungs. Now, the thing that we have also noticed that, okay, you have a blood clot, it's being treated, you're taking blood thinners. There are small vessels in your lungs that may not open up. So there might be some very, very tiny vessel, they still have microthrombi, and that can lead to chronic thromboembolic disease. So this can be a little bit challenging because the symptoms for those patients who have small tiny clots at the periphery present like a heart failure patients, or they have this undiagnosed dyspnea. We tried everything, but it's still not going away. So we do different workups. Patients who resolved with all the symptoms, the treatment with an anticoagulation is for 3 months. However, if there's any questions why this patient is not doing well, what's making things worse, further workup has to be done, like echo, ultrasound of your heart, ventilation perfusion scan to see if there is anything else at the periphery that potentially might be still closing the vessels in your lungs. And those patients might have to be on a little bit longer course of anticoagulation. So these are just a couple of pictures I wanted to show you. So what the arrows are the blood clots. So you can see normally it should be this white area, it's the fully open vessel, but when you see the darker area that the arrow points to, these are the clots, they're filling up the vessel. So it's kind of like clogging the pipes. So clogging the pipes calls to spilling stuff over. And that brings us to pulmonary hypertension. So pulmonary hypertension is caused by your blood vessels in your lungs getting thicker. And this is because things are working much harder than it's supposed to. So if you clog something, everything is backs up in the back. So especially with patients who have pulmonary embolism, you can have development of the pulmonary hypertension that's very common, leading to actual heart failure. So these are very important factors to consider in patients who had pulmonary embolism during COVID infection or post-COVID infection. And this is just kind of an example, a picture to show you. So on the left side, you have a normal heart. The blue is the pulmonary artery and the right ventricle. On the right side, you can see the right ventricle, but the pulmonary artery at some point has little constriction. So you can imagine it's hard to push blood through the constrictions. That means things are gonna back up. So things are backing up to your right ventricle is getting overloaded. It can get stretched out. It's not pumping well now. So you can develop right-sided heart failure, difficulty laying down, fluid in your legs, fluid around your lungs. And now we're getting to the most common symptom that I see patients in my clinic, which is airway inflammation that causes cough, wheezing, and chest tightness. Very typical symptoms of asthma. So whoever has asthma, I'm sure you guys are aware of it, how it feels. So we have 3 groups of patients. We have patients who never had asthma in their lives, but now they come with those typical asthma symptoms. Then we have patients who never had asthma again, but they have allergies, seasonal allergies, dog allergies, cat allergies, different things that predisposes them to having some airway inflammation. And then we have a patient who do have asthma and have a worsening symptoms now. And obviously I should have included it patients with interstitial lung disease also and patients with COPD. Symptoms with those patients definitely do get worse and patients get exacerbations of the ILD, interstitial lung disease, and COPD. Small airway disease and reactive airway disease, it's more of air trapping. Your airways are inflamed, persistent inflammation causes airway stiffening, and then you start developing functional reactive airway disease that can change the remodeling of the airways and can start scarring in your airways that will continue to progress and cause issues. So my point with this is, if you have symptoms, you have to treat them. If you continue to scratch yourself, you will have a scar. So if you treat something and take care of it, you're less likely to develop long-term complications. So always see your doctor, tell them how you feel, you know your body, and hopefully there'll be a right treatment for you to get better in the long term. Now, one thing you have to remember, you cannot expect for things to get better right away. COVID has been known to cause symptoms for months and months. So starting a treatment may not fix your problem right away. It might take a couple of weeks for you to start feeling better. Another thing that's very commonly seen recently has been bronchitis. So bronchitis is an inflammation of your airways with significant sputum production. So patients are coughing up tons of mucus. They have a chest congestion, cannot cough up enough mucus, stuff gets getting stuck in the chest. So these are all signs of the bronchitis, which is still very common after the COVID infection. So bronchitis post-COVID does cause airway inflammation, narrows the airways, and when you have a mucus production and things are not coming out of your airways, things get obstructed and you have a more difficult time to breathe. And super infections. So when you're fighting a virus, an infection, your immune system is already in overdrive. So it's much easier for other viruses and bacteria to affect you. So you have to be aware of it. If you're sick with one thing, it's much easier to get sicker with other stuff from an environment or your close ones if they're sick. So be aware of it. Try when you already are sick, please avoid anybody who comes to your house who already has some vague symptoms who can potentially bring in a bacteria or another virus to you. Having multiple infections at the same time can lead to significant lung disease. So pulmonary workup. If you have any symptoms of prolonged cough, chest tightness, your activity and exercise tolerance have decreased, you should definitely seek a physician. There can be the cardiac or pulmonary effect after COVID. And the workup is relatively easy. We get a chest x-ray. If a chest x-ray is abnormal, then we're gonna get a CAT scan to see if there is anything else going on in the lung tissue that we can help you with. Lung function tests and 6-minute walk are very common things for us to do. Lung function tests test how well your lungs are expanding, test your mechanics, test the inflammation in your airways to see if the doctor can prescribe you inhalers to decrease any of the inflammatory changes and improve your symptoms. And there is an echocardiogram, which is the ultrasound of your heart to see if you have any signs of pulmonary hypertension, if there's any signs of the strain on the right heart after the COVID infection. Treatment options, everybody's different. People who do have significant lung disease after COVID, which includes interstitial lung disease, scarring, pneumonia-like changes, a lot of those patients require long-term oxygen. A lot of patients require inhalers to decrease inflammatory changes within the airways so we can decrease inflammation, open up the airways a little bit so that when the air goes in, you can actually have it flow nicely to the airways and the oxygen can actually get to your bloodstream. People who are in acute exacerbations, we definitely need oral steroids for them, so systemic steroids to decrease inflammatory changes. Anti-inflammatory drugs, people who have significant fibrosis and scarring in the lungs, we have antifibrotic agents who that can decrease fibrotic changes. It does not fix it, but at least slows down the progression of the fibrosis. Otherwise, being active, pulmonary rehabilitation are very important things for the patient with the lung disease. Activity. There is different exercises, weights, cardio, stretching that can help with your respiratory muscles, that can improve your oxygen levels, that can decrease your dyspnea index and make you feel better overall. But once again, you have to be evaluated by your lung doctor. Other supportive treatments, if you have a pulmonary embolism, blood thinners obviously are very important. If you have any other issues, Dr. Maguire will cover that. And then remember to get vaccinated. I think it's very important to protect yourself and your significant others and your friends. So is COVID-19 lung damage irreversible? Yes and no. Some people are very lucky. Usually initial lung injury can follow to some scarring, but some people are very lucky and the scarring can be relatively minimal. Some people are not that lucky and the scarring can be significant to lead to irreversible changes that can progress and lead you to further evaluation for possible lung transplant or antifibrinolytic therapy. The things to remember: do not smoke. People who had COVID, symptomatic, asymptomatic, some of them still smoke. It does cause a lot of damage to your lungs, and with you having even asymptomatic infection, it can lead to significant lung changes down the line. Stay up to date with your COVID vaccinations and definitely protect yourself and others. So these are some CDC tips I wanted to share with you, and I'm gonna probably repeat myself. So stay up to date with your vaccination, improving ventilation and spending time outdoors. So obviously don't stay with a large amount of people, especially if somebody who's got cold-like symptoms in a small spaces. Open windows, open doors if you have guests or your family members. Try to move activities outdoor. It's okay, it's cold, that's fine, they'll be fine. Obviously, if you have any symptoms, get tested for COVID. It's good to know and tell your significant others or your friends that you have COVID. If you have babies at home, you don't want to have an immunocompromised baby who just was born to get COVID, right? You try to protect them. So be aware of your symptoms and be respectful to others. If you feel sick, just stay home. Don't go anywhere. Don't worry, people will still love you and bring you stuff and you'll be good. We have treatments now, antiviral medications, so you can always do telemedicine with your primary care physician or pulmonologist if you qualify for Paxlovid. Or obviously, if you are not feeling well, you do have to go to the ER to be evaluated for other treatment that we currently provide for patients. And avoid contact with people who are confirmed on or suspected to have COVID. And that's the end of my presentation. I just wanted to show you a couple of pictures. My little 7-year-old got vaccinated. I've got one of my surgeons who got his shot. That was at the very beginning of December when we finally got vaccination, and me. Thank you so much for listening to me. Hopefully it wasn't too boring. And I'm gonna give the floor to actually a fun presentation right now by Dr. McGuire.
Thank you. Thank you for that introduction, and thank you, Dr. Coleman, for that really informative talk. I'm going to try to share my screen now. Give me 1 second here. Let's see if that. Okay. Hopefully that works and you can hear me. Okay, so now we're going to shift gears a little bit and talk about the psychological symptoms and experiences that people have experienced with long COVID, and coping strategies and treatments. And forgive me if there are, let's see. Okay, forgive me if I'm going to try to move through any slides where I might repeat Dr. Coleman. Hopefully there won't be too much overlap, but just very briefly, I work over in the Bordentown office at Behavioral Health with other psychologists, social workers, MDs, and nurse practitioners. And we we're in 2 locations, in Bordentown and in Newtown, Pennsylvania. We treat adults, older adults, and children with psychotherapy, medication management, TMS, assessment, testing, both group therapy and individual therapy. So, as we're talking about long COVID, and I just wanted to briefly put, there's so many different names that come up kind of representing the same condition. So I just wanted to, I'm going to be referring to it as long COVID, but all of these other terms are the same thing. And basically, as Dr. Coleman explained, long COVID is really a lack of return to the usual state of health following acute COVID-19 illness. And the conditions might include the development of new or recurrent symptoms that occur after the symptoms of acute illness have been resolved. So again, you can have a mild case and then of COVID initially, and then develop symptoms later. And it's pretty much agreed that usually it's about 3 months from the onset of COVID with symptoms that have lasted for at least 2 months that can't be explained by an alternative diagnosis. So there are so many symptoms, right, that that affect all different systems and different parts of us that are experienced in long COVID. And so I think it can be very confusing for people to really know whether some of these symptoms, which are just a lot of what we experience all the time at different times in our lives, whether it's due to the virus or whether it's due to something else. And so there's really no magic, way to know except for really knowing yourself, knowing your baseline, knowing your body, and really trusting your, any changes that you've experienced, and then, advocating for yourself, finding the right person to to do a full diagnosis, do a timeline of the symptoms so that you can get the right treatment. But today I'm going to talk about the psychological symptoms, and the most common, even though there are different ones. I'm going to talk mostly about mood changes, brain fog, sleep problems, and PTSD. So some people experience one or two of these persistent symptoms, while others experience many. Again, they range from mild to severe or debilitating. It can, as I said, occur in people who had mild or no symptoms at the time of the original infection, but it's more common in those with severe disease. So if there's any question, vaccine, obviously getting the vaccine is going to improve your odds of not getting severe disease. So therefore will at least, the data is showing at least 15% will lower your chance of long COVID as well. Just quickly, some statistics. There's, approximately 10 to 20% of people have been estimated to be affected by long COVID following the 12 weeks of initial infection. And one study found that a third of COVID patients had increased mental health issues after 6 months. So we know, right, that people are really experiencing a lot of psychological changes, a lot of psychological symptoms, even both for people who have gotten COVID, and as we all know, just in general, collectively responding to this COVID pandemic. Psychological distress, including depression, anxiety, worry, perceived stress, and loneliness before COVID, before the infection, is associated with a 32% to 46% risk of experiencing long COVID symptoms. So not only are there depression, are these symptoms being seen after the infection, after being infected, but if you are someone who has experienced psychological symptoms or managing depression or anxiety or high levels of stress before getting COVID, you're going to be at risk for developing long COVID as well. These psychological symptoms are also associated with a greater risk of daily life impairment due to COVID. And they've even seen that the emotional distress could be maybe a stronger predictor than some medical conditions like obesity, asthma, and hypertension for developing long COVID. So it's very clear that we have to take the emotional health and symptoms of people very, very, take it very seriously, because they very much interact with and affect our medical health as well. So as I said, I'm going to talk a little bit about brain fog and memory deficits, sleep problems, depression and anxiety, and PTSD. So the reasons for the psychological impact of COVID, right? It's a result of specific effects on the brain, right? Like a direct, they're learning more and more, of course, of the direct mechanisms that are at play, but we know that there are direct effects on the brain and on the immune system and other organ systems. There's also the result of an indirect path, right? Of the traumatic aspects of the experience of having COVID, especially if you've experienced severe disease and you've been in the hospital or you've been in the ICU, especially if you've been ventilated. So these, experiences of isolation, the disruption in daily life, the collective fear of not knowing, the future or what this is all going to mean. So there's a lot of indirect kind of aspects of the experience that contribute directly to psychological symptoms. There's also the result of a sense of despair patients experience from long-term breathing problems, from fatigue, from other medical symptoms, with, no end in sight, no explanation as to when it will end, when it will lift, when these symptoms will lift, if they will. So of course, that's going to weigh heavy on people and affect them emotionally. Unfortunately, there's no magic treatment, no pill, no surgery that's going to alleviate symptoms. There's no, magic bullet, but we know that, as I said before, knowing yourself, knowing your body, if you feel that something is different or has been different, getting diagnosed, getting, early intervention is the best kind of way to get the treatment you need. So we're going to start with brain fog. Brain fog is not a medical diagnosis, but we've been hearing about it a lot, and it's kind of a collection of symptoms that can be due to many different things. So often people complain of short-term memory loss, of confusion or poor attention and concentration. Tasks may take longer than usual. There's organizational deficits. These are really issues and problems with our executive functioning. There's a lack of mental clarity, a fuzziness often people complain of. And, there's no direct diagnostic test. Our testing for this there's limitations, even though there are some inflammatory markers that are found. It's really going to be, again, understanding the symptoms you're having, the changes that you've experienced from before, and how it's kind of disrupting your life. And so, really kind of identifying the deficits in terms of a timeline is important as well. So some of the things, the interventions that we can do before maybe, or in order to know whether we need to move on and get an intervention and treatment, is to make sure you're doing the things you can control at home. So for example, managing stress, taking breaks from the work that you're doing or from the things that might be overwhelming, getting outside. Diet is very important. We all know the foods that are healthy for us to be eating. So we want kind of brain healthy foods. I won't go into them specifically, but exercise is so important. We think of exercise as really helping to, increase or strengthen our body's muscles, but there's a lot of data on how it helps the neural connectivity and memory formation. It helps us focus and increases, adrenaline into the blood, which increases growth in the hippocampus. The hippocampus is involved in memory formation, in being able to focus, plays a big role in learning. So if you're having symptoms, that in terms of brain fog, then you're going to want to make sure you're doing everything you can to try to see if that will help lift the symptoms. So exercise is key. Limiting caffeine and alcohol. It often, it seems intuitive, but of course, if you are not feeling focused, and if you're not feeling, you're feeling foggy and you have to go to work, it makes sense in the moment to maybe have that extra cup of coffee. But again, for many people, that might make the symptoms worse. So really being careful about your diet and your caffeine and alcohol. And of course, sleep is so important. So poor sleep in and of itself can cause brain fog, right? So we really want to make sure that we're prioritizing sleep. And I'll talk a little bit now about that, since that's a very common symptom, either chronic fatigue as a symptom, or just not being able to sleep well is a very common symptom for those who experience long COVID. And when we talk about sleep, we really want to think about our sleep hygiene. So setting ourselves up to be able to have a good night's sleep. Now, there's a myth that we all need some, 8 hours of sleep, which is of course not true. Everybody is different. Some people need more, some people need less, and not everybody, of course, you're not going to have a perfect night's sleep every single night. So part of it is not getting too distressed over having a few nights of poor sleep. But setting yourself up by setting a schedule, not forcing yourself to sleep, right? So if you get into bed and you're not sleepy, you got to get out of bed so that you're not associating activity in bed. Don't do work in bed, don't watch TV in bed or reading even, unless it works for you to fall asleep, of course. But this is if you're having problems. You want to get yourself up until you start to feel sleepy and then try to sleep, avoiding alcohol and nicotine and caffeine, avoiding big meals before bedtime. And definitely avoiding napping. I know a lot of people who tend to have bad nights of sleep, and then they say, well, of course, then I'll just take a nap the next day, but then they're wondering why their sleep schedule is so poor. Really want to stick to the schedule and not nap so that you can kind of get back into a normal sleep pattern. Exercising is going to be helpful for sleep, but of course, try not to exercise too close to bedtime. And really set yourself up with a positive sleep environment, meaning, have a cool room, dark room, a comfortable bed, everything you can do, because again, some of these things seem so intuitive, but we often kind of neglect some of the basic things. And if we just have a kind of checklist and really make sure we stick to that, it can make a big difference. Some people also find it's helpful to keep a sleep diary. So if you, to kind of track your sleep in order to see different patterns that you might find that you may not have realized. So that can be helpful as well. I'm next going to talk a little bit about COVID and depression. Again, there's both a direct pathway, signs that there's a direct effect related to the COVID virus, and they've found that the risk of depression increases with the severity of COVID-19. But I think what's important is really understanding, again, the kind of daily stressors that we all experience as human beings, and the overlap then into clinical depression, because when it's time when you are starting to feel more significant symptoms, it's then time to kind of maybe reach out, get assessed, get treatment and intervention like medication and therapy. Even if the depression is a clear symptom of long COVID, it requires and deserves its own attention, its own treatment. So for example, feeling overwhelmed, feeling nervous or anxious, and even trouble sleeping, feeling, that you can't overcome difficulties in your life, eating more or less than usual, sleeping more than less than usual, troubles with concentration, memory, anger, rage. These are all things that most people are going to experience from time to time. But if you notice that you start to withdraw from other people, you're having thoughts of suicide, you're feeling sad and hopeless about the future, lacking energy, enthusiasm, and motivation, having trouble making decisions, being restless and agitated and irritable, feeling bad about yourself or guilty. When the symptoms have moved into that realm and they're really interrupting your day-to-day functioning, then it would be very important to reach out for help, for professional help, for treatment, because we have, again, there's a lot of different types of treatment, including therapy and medications that can be really helpful. Similarly with anxiety, which again is very common for people with who experience long COVID. Studies have linked brain inflammation and nerve cell damage found in COVID patients to the development of anxiety. So it's really common, and that was even controlling for age and sex and other medical symptoms. So we know that there's a direct pathway there. And again, knowing yourself and knowing your typical experience with everyday stress, everyday anxiety, worry about, on the left in the green are kind of common worries that we all experience. But then if you look in the red column, it's when these worries become a little bit more disruptive in your life. If you're avoiding social situations, because you're, fear of being judged, if you're having out of the blue panic attacks, irrational fears or avoidance of objects, places, situations, or recurring nightmares or flashbacks, it's going to then again, the anxiety may be moving towards an anxiety disorder, which then requires an intervention of therapy or medication. And so definitely reach out for help in that if you're experiencing that. A little bit about post-traumatic stress disorder, which we're also seeing in patients, especially patients who have been hospitalized, especially those who are hospitalized with the ventilation support. It's you can see the statistic there. It's as much as 35% of people experience post-traumatic stress symptoms, as opposed to 15%, which is the general population rate. So these are symptoms that are in response to a trauma, which obviously being hospitalized and with a ventilator, obviously would be for many people a trauma, but other things in terms of COVID as well. Other experiences could be a trauma. A trauma is simply a threat that you are not, your body and is not equipped to respond to in the moment. So people experience intrusive memories, avoidance behaviors, hyperarousal and reactivity, mood disturbances, and these experiences, these symptoms are experienced for at least a month. And then, so that would be, you would then be diagnosed with PTSD, and then again would want to reach out and receive treatment. In terms of interventions, as I said before, it starts with really knowing yourself and your body and your functioning, trusting yourself. I know I've heard a lot of stories of patients, especially in the beginning, complaining of a lot of emotional symptoms or psychological symptoms and being kind of shut down by, either physicians or by family members or by whoever they're speaking with, because, I think maybe they're told it's all, it's just, it'll go away, it's all in your head, whatever it might be. It deserves attention and treatment. So if, it's important to get an accurate diagnosis, to get an accurate timeline so that you can work with someone to see what treatment will be the most effective for you. There are executive functioning, there's executive functioning coaching for cognitive deficits that you might be having. There's cognitive rehab. You can learn compensatory strategies, like using a notebook if you're, not remembering things, or a calendar. And while that may be frustrating because you find, because it's such a difference from where you were before COVID, the good news is the brain is there's plasticity. The brain can change. You can get better. These strategies work. And so I think to stay hopeful and to stay positive is really important, because, fortunately, there are things and treatments you can do to get back to the functioning that that you're used to. As I said, therapy and medication is a gold standard for most psychological symptoms, but there's all different types of therapy that works, support groups, social support is so important, and having realistic expectations, being patient with yourself, with your family members, is really important. I want to talk a little bit about mindfulness. I know we're getting, oops, sorry. We're getting, oh, what just happened? My screen share sorry, there it is. I don't know why it's not going, but I'll start. So a little bit about mindfulness. So mindfulness is a really important and effective tool for many different symptoms, for many different difficulties you might be having, and it's simply just the quality or state of being conscious or aware, right? It's the mental state achieved by focusing on one's awareness of the present moment, while acknowledging and accepting one's feelings, thoughts, and bodily sensations without judgment. That's a mouthful, but there's a lot of misconceptions about what mindfulness is. It's not being zen or emptying your mind, or being relaxed all the time. It's quite the opposite, actually. It's really an active practice that can be cultivated through many different practices, through yoga, through Tai Chi, through meditation. And there's a lot of research on the benefits of mindfulness. So especially if you are experiencing depression or anxiety, mindfulness can decrease rumination. It enhances memory and attention. So again, it has positive effects on the hippocampus and other neurological processes that help us. So if you're experiencing brain fog or any cognitive issues, it can be helpful for that. It improves our emotion regulation and reduces emotional reactivity. It helps us to kind of have a different relationship to our thoughts and our feelings. So it can help us to manage stress and be more intentional about our relationships, our decisions. And then physiologically, it helps to reduce our heart rate. It can improve sleep, improves immune functioning, relationship satisfaction. So it's a really, the good news about mindfulness is it's extremely accessible. It's really all you need is your breath. So there are lots of apps out there that can help guide you through different mindfulness meditations. Headspace is one of them. Calm is another one. There's a lot of literature on mindfulness. And the difficulty is you can read all about it and know that it's helpful, but it comes down to practicing it. Just like going to the gym, if you're exercising or training for something, it requires commitment and practice, but it can be a really, really helpful and effective tool for a lot of the symptoms I've been talking about. So I thought, and I know we're really late on time, so I was going to just do one mindfulness breathing exercise. It's very brief, so if whoever would like to do it along with me, I'll guide us through it. So I just want to invite you to close your eyes if that's comfortable for you. And if not, you can just allow your gaze to drop and let your vision soften in its focus. And just take a breath on purpose. Feel your belly expand as you inhale and collapse as you exhale. And just feel that movement in your body. Notice how the chest lifts as you breathe in and drops as you breathe out. And see if you can focus your attention to stay with the movement of your breath in your body. Inevitably, distractions will come up, whether it's a sound, a sensation in your body, a tension in your body. Whenever distractions arise, just notice them. They're inevitable. And come back to your breathing, paying attention to the sensations of your breath. And on your next inhale, just notice that there's a space between your inhales and your exhales. You breathe in, there's a brief pause, almost as if your body knows when it's full of air, followed by an exhale. And just see if you can catch that brief pause. On your next inhale, breathe in, feel the pause, hold it for a moment, breathe in a little deeper, like you're taking in an extra sip of oxygen, topping up the lungs with air, and then breathe all the way out. And notice what that feels like in your body. Repeat that at your own pace a few times, breathing in, feeling the pause, taking an extra breath in, and exhaling all the way. Allow those distractions, the thoughts, the sensations to come, and then allow them to go as you bring your attention back to the breath, as you notice your mind becoming distracted. So before we finish, just take a brief moment to notice what it feels like to be in this moment. Notice if you feel any differently than when we started the exercise. And still with your eyes closed, you can bring your attention back to the room, noticing the sounds in the environment, the chair under your body. Start to bring motion back to your body, wiggling your fingers, rotating your wrists, or rolling your shoulders. And when you're ready, you can allow your eyes to open.
Dr. McGuire, you have to come home with me and to work.
Okay, let me,
So thank you very much, Dr.
There we
Coleman,
go.
and Dr. McGuire. We will go to questions. Before we do that, I just wanted to remind people that the evaluation survey link is in the chat box. I would really appreciate it if you could fill that out tonight before you leave. Like if you're not staying for the Q&A, that would be great. Because I get ideas for our next semester of lectures from those. And of course, we want to see what you thought of the program as well. Also, there's a recording link that I put in the chat box if you want to see the recording afterward, and that should be posted within a week. Let me get my video back on. Not that I really want
So
to.
Marcia, I just wanted to say something. I do apologize to anybody who actually thought that I used too many medical terms. Usually when we make presentations for clinicians, we put a lot of numbers, data, predictive values. So I did try my best to keep it as simple as possible. So just to summarize my presentation, is that COVID leads to a lot of inflammatory changes in your lungs. And those inflammatory changes can cause airway disease, swelling in your airways, mucus production, and symptoms like wheezing, cough, as well as scarring in your lungs. So it's very important to keep an eye on your symptoms and do go to the physician to evaluate those symptoms so they can be treated, so you can actually improve and hopefully have a better outcome than some of the patients that did have significant lung damage. So once again, I apologize if I use any big terms. I did try my best to keep it very simple, but my apologies.
So I'm just going to read through the questions now, and feel free to answer, Dr. Coleman, Dr. McGuire. To both doctors, do you have anyone else experience of a reduction in long COVID symptoms after getting after getting the vaccine? If you need a subject, I am available.
So from respiratory standpoint, people get affected by COVID less and less. That means they do have less pulmonary symptoms and complications after COVID. So the vaccination do help you with not getting very sick. Now, as far as everything else, I don't think we have enough data to actually comment on it at this point. Dr. McGuire?
yeah, I mean, you'd know better. I agree. I don't think they know the direct line between getting a vaccine and long COVID symptoms, right? It's kind of because it protects you from severe disease. You're gonna, yeah.
Yeah, we've been 2 years out. I mean, usually when we have research, it's days
Yeah.
out. So we're gonna see much and more stuff. I mean, just looking into acute lung injury from the vaping, right now we just before COVID, we had multiple articles and how we're supposed to treat, and we started teaching about not doing e-cigarettes for smoking cessation. So I think all of this, these new things will come within the next couple of years regarding complication post-COVID and vaccination correlation.
Do you recommend any herbal treatments for post-COVID shortness of breath and fatigue?
So you guys gonna laugh at me, but I have a mom who gone through breast cancer, and she's very big on naturopathic stuff, and a lot of the stuff involves anti-inflammatory things. So curcumin, garlic, vitamin D, vitamin E, all of this stuff. Once again, there's not enough data out there, but I always look at this way: if you can be healthy, if you don't drink, you don't smoke, you're active, these are the most important things that will keep your immune system boosted and healthy. And if you supplement it with something that potentially may improve your immune system, why not? But once again, don't quote me. There's not enough data to say if the other stuff actually does support your immune system. And I'm not sure Dr. McGuire have more stuff to say about this.
No.
I do have to read up on it more.
Is having only one Pfizer booster good enough for protection?
So as of September 2nd of this year, we actually, there's a new vaccination, which is bivalent booster. So this vaccination is a pretty much a combination of the original vaccination, which has a 30 milligrams of the original vaccination in it, and the micrograms, and the 30 micrograms of the Omicron vaccination, variant vaccination that we have received after we had another surge of COVID. So it is much more stronger, potent vaccination. So I say most likely we're gonna get into once a year of his vaccination for COVID. If you have not getting boosted over the last 6 months, and obviously we are seeing people still getting sick, I would say the recommendation is there to get the stronger booster so you're less likely to get sicker. Now, it's everybody's choice, right? It is a recommendation, but once again, think about your health, think about your friends and your close ones.
If you're fully vaccinated, do the vaccines have the side effect of making your immune system not work properly?
Vaccination actually make your immune system produce antibodies to fight the infection, right? So actually boost your immune system. I know there was some, a lot of people say you get vaccination, it does suppress your immune system. The goal is when you get vaccinated, your body gets exposed to something and then you produce antibodies. So when you get exposed to it, you fight it. So that's the basic principle of vaccination. You make antibodies to fight the infection so you don't get very sick.
Can COVID cause a stroke in a healthy person?
Absolutely. As I mentioned in my presentation, COVID, even in asymptomatic patients, can lead to hypercoagulable and prothrombotic state because of the inflammatory changes that can take place after 4 weeks after initial infection. So yes, patients can have microthrombi, they can have mini strokes, they can have small pulmonary embolisms that can affect their well-being.
Please review treatments for long COVID-19 bronchitis for patients with heart disease.
Well, whoever has a bronchitis, obviously you do have to come to the physician. I'm a strong believer you have to listen to the patient's lung to see how they sound. Just because somebody has, say, they have just a cough and a trickle in their throat does not mean that they need to be put in a therapy that's significant. And a therapy goes with side effects. So you have to go see your physician. You have to be seen. You have to be listened to. But the simple treatments are short-term inhaled corticosteroids and bronchodilators, medications that do not affect you systemically, but decrease some inflammation in your airways and open up your airways so the air can go through and the mucus production does decrease. So these are the basic treatments. Obviously, with the heart failure, if you have atrial fibrillation and other comorbidities, you have to see physician once again in person, so you can physician can decide if those medications are appropriate for you. Some medication can cause atrial fibrillations, palpitations. So once again, everything has to be directed towards specific patients. But treatments can be relatively simple and not long-term, but a short-term treatment that can improve your outcomes.
Have you seen post-COVID white coating and tongue stuck to roof of mouth while sleeping? Wake up, can't catch breath unless drink water.
So I would say sleep apnea should be probably worked up. That means you're a mouth breather. Your mouth gets dry. If you have a white coating, I mean, if you're using inhalers, inhaled corticosteroids, if you do not rinse your mouth after your inhalers, you may develop thrush on your tongue, which is the white coating. Otherwise, if you don't use inhalers, if you compromise because of rheumatoid arthritis, being on other medications that can suppress your immune system, you're more prone to developing thrush also. But dry mouth, tongue stuck to the mouth, these are signs, and getting kind of the shortness of breath, some tightness in your chest can be signs of sleep apnea, and that's something that needs to be evaluated.
Okay, thank you.
It's
And
so hard to know if I have long COVID symptoms. I had the first round of 3 COVID infections in January 2021 and believed I had long COVID with exhaustion and went to Deborah for evaluation. Got it 2 more times this year, had 2 initial injections and 1 booster. All 3 times have been mild, but left me in a fog with breathing issues. Can't afford asthma meds, so I use a daily inhaler. Can't remember much at work. Is there a way to sort it all out?
Well, I guess maybe Dr. Coleman, you want to speak to the breathing issues. I mean, I think whenever there's, trying to sort it out is the most frustrating thing for people. And I think staying, remain persistent and, start and just kind of start with, your primary care physician or whoever you're going to, and really try to have a clear timeline. And, if you're having, it seems like you're having some brain fog, then you might want to, speak to someone about the cognitive issues that you might be having. So really just try to kind of put the pieces together. I know there's no kind of right way or one way to go about it all. I think start with the symptoms that are really interfering the most, and maybe those are the breathing issues, and start there. But I think just trying to kind of put these pieces together and staying persistent is, and seeing all the, the people, the different specialists that you need, is the way to go. No, that's not a satisfying answer, but.
Have you encountered any patients with long COVID who are having problems with their eyes?
Not me, personally, no.
Yeah, I mean, I wouldn't be I wouldn't know if there, I mean, there may be, but they wouldn't be coming to me.
How to know when brain fog symptoms are related to long COVID versus side effects of many typical senior citizen medications?
Yeah, it can be very difficult. Again, I think speaking to the prescriber, the people who are, your physician who's prescribing you those medications, and being really in depth and clear with your symptoms and going over, whether it might be side effects or not. And of course, again, a timeline. And again, I think, if it is a side effect of a medication, then maybe there's a different medication they can try. But regardless too, if it's from the long COVID or not, getting direct treatment for the symptoms, right? So if it's cognitive deficits, there are different treatments available. There are different strategies available. So certainly, it's important. You want to know, what the symptoms are, what they're from in terms of changing medications, if that's the reason, but also just focusing on reducing the symptoms and getting strategies to help with that as well, and treatments.
What is executive functioning coaching?
So when I talked about, so part of the complaint of brain fog are these kind of what we call cognitive functioning deficits. So the problems with organizing, the problems with kind of executing tasks. And there are now, I had a slide up, so I'm sorry, I didn't stop on it. There are now COVID clinics too that really, if you're feeling like you're not getting the right kind of response or a full picture of your symptoms, these are the clinics on my slide before, and there you can look them up. There's a lot of them. They're doing, again, they're looking at, a holistic picture of all the different symptoms that patients are coming to them with. So they, again, if you're not, that's one place to look. But there are executive functioning skills groups. So we actually have one. I'm holding a flyer, which is facilitated here, and it's a group that teaches different strategies to help with those deficits that in executive functioning.
Thank you. Mentioning all these treatments are available to anyone with insurance, but for anyone that has a huge deductible, they may be out of reach. I would appreciate knowing what I can do at home alone with no one there.
So I think you are one of the many patients who are struggles with it. I have a lot of patients that myself and my colleagues see. We put patients on inhalers to improve their symptoms and breathing, and guess what? Nothing is covered, and deductible and the the payment for the inhalers is in 300 per hundreds. So unfortunately, it is a very difficult thing to deal with now. Um, we do try help our patients who do not have insurance to help with samples from the office. And once again, we try to give you samples that we have for 2 weeks to see how you're tolerating. And if there is something we can help with for a longer time, we try to provide those samples. Otherwise, we do reach out to the insurance companies and to other places to see if you can patients can get more support to get medications, especially after COVID and having respiratory complications. At home, it still comes down to a very basic stuff, being healthy, right? I know it's very easy to say, I cannot tell you to start working out when you're short of breath, right? But moving around, getting things done, trying to change your diet to eating less fried food, but eating something more healthy might actually improve and decrease some of the inflammatory changes. So everything comes down to us not eating processed foods at home. Try to move a little bit. If you use a wheelchair to go from kitchen to the bathroom, maybe you can have somebody, or if maybe you can make 2 steps or stand at the kitchen counter and do some cooking or washing dishes, simple activities here and there, and making some progress every day. Hopefully it's going to decrease some of the inflammatory changes and make you feel better. But once again, it's a combination of being healthy, being active, and obviously some of the medication that can speed up the process of the recovery. So I think as physicians in the hospitals, we're trying to be supportive of patients who don't have insurance coverage. But I understand it's absolutely very difficult. And I apologize if we cannot help everyone, but we are trying very hard to make things happen.
We do have a few more questions. I always hate to cut off the questions. It is 7:25. I know my goal is always like 7:15, just people's
Okay.
attention span. But we do still have 19 people on, so I guess people are interested. Are you okay staying another 5 minutes to answer more questions? Is that
Absolutely.
okay? Okay, thank you. As a supervisor, how can I support my staff that is still suffering from brain fog?
Well, I mean, certainly, I think, some of the things that I mentioned in terms of for individuals to consider, right? So kind of breaking up tasks. I mean, it can be, so these individual things can kind of be applied, hopefully, depending on where you're working, but breaking up tasks, allowing for, again, if possible, allowing for breaks outside, getting outside, so important. I mean, I can't say it enough. Moving, exercise, so any activity. And also I think, again, I think what goes so far is just validating somebody's experience, right? It's extremely frustrating to have brain fog. It's extremely frustrating to try different strategies and not feel like they're working and not get an answer. And so I think what's really important is having the people that work for you feel heard and feel understood, and then hopefully they can there are resources that they can go to individually and get the treatment they need specifically for them. But validation goes a long way. Understanding and just empathizing goes a long way as well.
As a person that has asthma and had more than 6 months of specialized and increased follow along from a pulmonary specialist because of COVID in January 2022, how can I improve my lung function back to normal?
So pulmonary rehab An exercise program for patients with post-COVID lung complication would be a place to start also. Otherwise, obviously using your inhalers, being active, being healthy, that helps at home. But once again, I'm preaching to a choir. It's for all of us, not even patients who are having COVID. But once again, being healthy, and then reaching out to your pulmonary physician to see if you qualify for pulmonary rehab. This is the place who treats patients with lung diseases to improve lung capacity, improve breathing, improve your oxygen requirements, and hopefully get you back to baseline. Now, as I mentioned in my presentation, to get back to baseline might take months after COVID. So I don't want to be very over optimistic for a lot of patients. You have to be patient. It is a disease that does affect a lot of organs and does prolong recovery for a very, very long time.
Having contracted COVID in 2020, one of the long-term effects has been the loss of taste and smell. Is there anything that can help improve the return of those senses?
Okay, that's a little bit tough questions. I recently did have a patient who have asked me that in a pulmonary clinic. Obviously, I deal with things below the neck and above the diaphragm. But I did look up actually options. So obviously your neurosensory system gets affected by COVID. So COVID is known to affect your nervous system as well. Hence other complications, headaches, migraines, the mood swings, psychological issues that can be brought up. But I did look up that there is a smell training therapy. Please, you can look it up. I do not know much about it, but supposedly what it involves is exposes the patient to different strong smells for several minutes at a time for a couple of weeks. And then supposedly your smells come back to normal. Once again, I don't know much about it. And I think patients who do have a multitude of different symptoms post-COVID, I think it's a great idea to actually explore the long COVID clinics. They have a psychologist, neurologist, pulmonologist, internal medicine doctors, and all of these doctors you see, even speech and physical therapists, you see those doctors at the same time, and you have a multi-system evaluation, and you are put in a great program to improve your symptoms. So I would say if you're having, once again, if us and Capital Health cannot support you, there are multidisciplinary clinics that are specialized for the long COVID patient that can really help you with your symptoms.
I think maybe this will answer this one too, but I have had continuous severe symptoms since I got COVID in November of 2020. I want to know when it will get better. Vaccination helps, but only lasts for a couple of months. It sounds like those clinics would be helpful for that too.
Yeah, and I did there were a few in New Jersey. If you go back, if you're able to with the recording, I do have a slide that has a bunch of the recording, that has a bunch of the of clinics, COVID clinics. I mean, and you can look online too, but it is a good place to get supported, I think.
And I will post that again, but it is in the chat box with the recording link, which again would be posted probably definitely within the next week. Sometimes it's just a few days. I have questions in reference to cognitive, mood, and exhaustion effects. I have my hand raised in pictures. Can you call on me, Susan? Sure, Susan.
Hi, that's me.
Okay.
Wait, am I muted?
No, you're good. We hear you.
Oh, okay. If for some reason it doesn't post. Yes, couple questions. Actually, I want to just give you feedback more to the psychiatrist because I've had mild cognitive impairment, and I've had brain testing, and my executive function is below average. So I struggle with organization. I've developed some coping, and I struggle with time management. And but I moved to Florida like a year and 3 months ago. People are not careful here about COVID. I know I had COVID for sure in July after going to a conference, but I think I may have had it in the winter. I had negative tests, but my symptoms, my doctor said, were like other people who had the COVID. We didn't know if it was COVID or if it was like a sinus infection. But I still have like, I can get extremely exhausted. That's kind of carried on. And that was my main symptom during the 2 weeks of having the COVID. I've had 4 vaccines. So one question I have is, I had the COVID in July. When can I get the latest vaccine?
I'll leave that.
So, Susan, you can get the latest vaccine. What did you say you got your last booster?
My last booster was before I got the COVID, and I got the COVID in July, for sure.
So patients who do have COVID, you can delay your vaccination, 90 days later, because of obviously you got a COVID, your immune system is high and the antibodies against the COVID. But I would say, now coming November, December, 3 months after your COVID, if you're interested and willing to get the bivalent vaccination just came out, obviously there'll be a good time to do it within the next month or 2.
Okay. The other question is, since I moved to Florida, but I come back up north because I'm not impressed with the medical care down here. Do you know if there are COVID clinics in Florida?
I'm sure they're everywhere. I just did, I searched just around here, I think, and I might have put more national websites as well, but I think they're all over. So I'm sure you could find a clinic in Florida.
Okay. And would they do, you mentioned for the brain fog and the cognitive executive functioning exercises or training, would they do that? Or if not, could I do it with you guys through Zoom or when I'm up there? Or
so the one that we have, for everybody, if you're interested, Meredith Crane is the social worker who is running this group. It's called Working Smarter, Not Harder, an Executive Functioning Skills Group. This is an in-person group. It meets here, and I believe it's an 8-week program. So and then it'll start again. But I think the other thing is there are a lot of different there's cognitive rehab, which is a little bit different. It's a little bit broader if your functioning requires that. So that's an option that there might be in Florida near where you are. There's also online groups. I was going to say to the person who wrote, that they don't have access to doctors and things. And so for at least psychologically, there are a lot of support groups online that are free. There are different, as I mentioned, some of the things you can do on your own, these apps that are really helpful. So organizational apps, mindfulness apps, meditation apps. So, there are ways I think you can get some support if you can't get to your doctors, but.
What do you suggest to help with fatigue? Almost 10 months after COVID, I still have episodes of exhaustion after minimal activity.
Yeah, that is very common, especially that kind of when you've that exertion, when you've kind of exerted yourself, and typically you'd be, it wouldn't take much out of you, but you've noticed a big difference after doing a task. Again, there's no one answer that's going to work for everyone. I definitely think if it's been lasting that long, hopefully you've gone and spoken to, gotten, evaluated and kind of see if there's other things that could be contributing, or things that, any sort of intervention that could be helpful. Medications can be helpful. So certainly get assessed. And then again, some of the things that we've talked about in terms of going through the kind of checklist of what you're able to do at home in terms of your own day-to-day health. So eating well, getting enough sleep. Again, we sound like a broken record, but exercise, even though I know it's probably very hard. So, going through and trying to see if any of those things can help improve it. And again, being compassionate with yourself and patient, because it does take a while sometimes to feel back to yourself or feel better. So I'm sorry you're dealing with that.